Hey there, future nurses. Welcome back to Guided by Night. I'm Dr. Knight. If you don't know, your DNP nurse educator and mentor. Today, guys, I really want to concentrate on what I believe is one of the real challenges for nursing students during clinical rotations, and that is how to perform an assessment on a non-communicative patient. I'm talking about that patient that you walk in a room and they can't speak a word. They're not saying anything to you. I mean, I've seen students walk into those rooms and actually turn right back around and just say, I don't know where to start, because they are unable to just ask a patient a question. That is why today, guys, I'm going to be showing you how to use your eyes, your ears, and your intuition to assess what words cannot tell you at this particular time. And we're going to do this in under 5 minutes. So pay close attention. Listen up. First thing is first, I want you guys to observe. Do not touch anything. Do not touch a patient. Just walk into the room and observe. I mean, look at the monitors, look at the equipment, and look at the environment. The environment will begin to tell you the story about your patient. So pick up those cues that you find when you are observing the patient's room. The next thing I want you guys to do is look at your patient. And when you're looking at your patient, you are going to be looking for particular things like, for example, you're going to be paying attention to see if your patients are grimacing, are they pale, are they restless, are they calm. Even if your patient cannot speak, I'm telling you that their face, their posture, and their breathing speaks volumes to you. Pay close attention to these subtle things. Next, we're going to move on to the respiratory system. And here's where you're going to be assessing your patient's airway. Is the airway clear and patent? Are your patients on oxygen? Are they on a ventilator? Or are they breathing room air? These things you must pay attention to. And then we're going to move on to listening to your patient's breath sounds. And here's where you're going to be listening for crackles, wheezes, or diminished airflow. Observe your patient's effort, their respiratory effort. Are they using any accessory muscles, or are they struggling to breathe? Remember, a patient who can't talk will still be gasping for help. So pay attention to these subtle things, guys. They're very important. Next thing, I want you to move on down to your cardiovascular system, where we're going to be concentrating on circulation and perfusion. Here's where you guys are going to be performing your vital signs. You're going to be checking for pulses, heart sounds, and you're also going to be looking at your patient's skin color. If your patient's skin is cool, clammy, or you might pick up any weak pulses, this is a sign that there may be some perfusion or circulation problems. Guys, pay attention to whatever you're finding, compare it with what's on the patient's monitor. Next, we're going to move right into the neural system and include your pain assessment. Here is where you're going to be checking your patient's responsiveness using your Glasgow Coma scale and your ABPU scale, which is alert, verbal, pain, and unresponsive. Check your patient's pupils, limb movement, and their reactions to pain. This is real important. Pay attention to things like, is your patient experiencing any tightening of the jaw, any grimacing, or increased heart rate? This can indicate that your patient is experiencing pain. I want you guys to please recognize that there are many, or there are multiple skills that you can use, but the Glasgow Coma scale is very popular. And please make sure that you become familiar with the type of skills that they are using based on the unit that you are assigned to. If you're unfamiliar with these skills, take the time to look it up. You guys have access to so many resources. So if you're unfamiliar with the Glasgow Coma skill, look it up. If you never heard of the AVPU skill, look it up. Start being responsible for your own education. Start looking up things before you enter the clinical environment. Or if you hear something that you're unfamiliar with, please look it up so that you are able to perform when you are in the clinical environment. We're going to go into the GIGU and we're going to be looking at the patient's skin. Here's where you're going to be inspecting the abdomen, checking feeding tubes, looking at urine color, and listening to bowel sounds. Examine your patient's skin, especially bony areas. Look for any redness, skin breakdown. And remember, even if your patient can't talk, they feel discomfort. So remember, while you are assessing, to reposition your patient and protect their skin. Guy, we're going to summarize and we're going to report off our findings, whether it be to another professional or your clinical instructor. We always use SBAR in the clinical environment when giving report. So remember, SBAR is situation, background, assessment, and recommendations. Situation, in this particular case, you can report of something like, my patient is nonverbal, patient vital signs are stable. Please give a complete list of vital signs, including the temperature. And then the background would be post-op day 1 or 2. Your patient is trach on 2 liters oxygen. Assessment would be responsive to pain, clear breath sounds, skin is intact. And lastly, your recommendations. Don't forget recommendations, which might be something like continue monitoring, reposition every 2 hours. Remember this, guys, you're not just observing, you're actually advocating for a patient that cannot communicate for themselves. They need you. Open up these skills and your ability to assess when your patient cannot speak. In closing, guys, remember, a non-communicative patient is still communicating. They communicate through every breath, every movement, and silence. Your role is to listen with your eyes, your ears, your hands, and your heart, your intuition. I'm Dr. Knight. I'm guiding you to think and act like a registered professional nurse every day. I want you guys to please don't forget to subscribe, like, and share this information with any nurse or colleague, student, friend that can use this information that's going to help them be able to assess non-communicative patients. Until then, guys, happy clinicals. I'll see you on the next video.